Doctors, good evening, and thanks everybody for joining us. As always, we hope you and your families are well. If I could ask you if you could be kind enough, please put your phones on mute. We'll decrease the background noise. We're excited about tonight's presentation and explaining what the benefit plan. So without further ado, let me turn this over to our president, Dr. Frank Proscia.
Thank you very much, Kevin. Great to see everybody here tonight. As always, I hope you and your families are safe and well. Tonight's presentation follows last month's forum on free tax prep for doctors and the tax preparation services and financial planning benefit through Doctors Council. We have received incredibly positive feedback on that forum and continue to do so, and members are using the benefit. We want you to be aware of your benefits through Doctors Council so you can learn about them and how you and your family can use them and save money in the long run. These benefits are provided totally, and they are protected because of the contract between the union and the employers. We also have our own Doctors Council benefits. We mailed out to all of you a link to the full summary plan description, the SPD, of all the benefits, as well as attaching a 4-page highlight booklet. Please know that these are exactly the type of benefits that employers tend to try to erode so that they increase their own profits. This shows the importance of belonging to and being a member of our Doctors Council union and having a contract that guarantees and protects your benefits and jobs. As part of the Doctors Council benefit plan benefits negotiated in the contract, as I said, by our union with your employer, you are a participant in the Doctors Council benefit plan. As an eligible participant, your employer makes contributions to the plan. Provided that you continue to meet the eligibility requirements, contributions will continue at no cost to you because of our contract. I hope you find tonight's presentation informative and useful. Thank you. Back to you, Kevin.
Thank you, Dr. Proscia. And thank you to everybody who emailed questions in advance. We're now going to put everybody on mute so we can go through the presentation. And the way we're going to proceed is Dan Donlan, who I'm going to introduce in a second, who administers our benefit plan, will carry us through the 4-page highlight booklet. Then we're going to go and answer the questions that were emailed us to in advance. And then we're going to go through what's called the summary plan description, the SPD document, on any benefit that we haven't touched upon at that point in time. If you have any questions you would like to ask, we just ask you to please send them to me in the chat. Put your name on it and what your question is. Time permitting, we'll try to answer all the questions. And whoever we can't get to, then by putting your name on it, we'll circle back to you and get back to you. So with that being said, it's my pleasure to introduce Dan Donlan, who administers the benefits of our benefit plan. And Dan will take it from here once I'm going to go ahead and share the screen. But Dan, you want to say hello first?
Good evening, everyone, and welcome. Just quickly want to thank everyone for the services you provide to our communities and all the hard work you've been through, especially through these difficult times. Thank you again. So what I'd like to do is first, as Kevin said, go through the 4-page booklet, which is the highlights of the benefits that are offered under the Doctors Council benefit plan. And starting off, if we look at page 1, there's top of the benefit is how most it's important to remember that these benefits are provided at no cost to you, so they don't come out of your dues. As Dr. Proscia stated, it's through a contract by the union that enables us to provide these benefits, supplemental benefits to you and your eligible family members. So keep that in mind and as we go through. Starting with, I guess, I'd say the most visible benefit is the health care cost reimbursement benefit. I say it's most visible because those are the benefits are the out-of-pocket expenses that you've incurred during the course of the year that you're able to submit to get reimbursed. And it's a myriad of different expenses that are subject to reimbursement. A good one or an easy one relatively is your medical insurance premiums, which come out of your paycheck. And it's easy to document that just by making a photocopy of your paycheck. You could even do it at the end of the year, which some members have already done. It shows a year-to-date deduction. This way, you don't have to be bothered with a bunch of different papers. It's just one deduction. You attach it to the health cost reimbursement claim form, and then you submit it to get reimbursed. So in addition to that, you have out-of-pocket expenses such as prescription drug copays, dental expenses that you've not been reimbursed for if you had to put out of pocket, off doctor's visits, office copay visits, any medical, dental, optical, prescription optical, and prescription drugs, not over the counter and not non-prescription glasses are eligible. The dental benefits is probably one of the other most widely used benefits under the plan. And it is the good thing about it is you have a choice. You can go to a participating provider, and there's a wide network under our third-party administrator, self-insured dental service, of participating dentists and different criteria throughout the country, actually, where you can go have services done and not pay anything. No co-payments, there's no deductible. So nothing out of pocket for everything that's covered under the plan, and the majority of the benefits, dental benefits are. Should you decide to stay with your dentist that you're comfortable with, that's also fine. You would then pay upfront to your provider and then submit a dental claim form and get reimbursed based on the fee schedule. So the maximum for the dental benefit annual is $8,000 per family and $4,000 per individual. The next benefit, I'd say, was a hearing aid benefit, which we actually expanded at the request of one of our members a few years ago, where they requested if the trustees could look into expanding the benefit to children. And we took it under advisement, talked with our consultants and the trustees and attorneys, and it turned out that yes, we were able to do that. So that's where the involvement of the members into this plan, you have pretty much have direct communication with us to make suggestions, and sometimes those suggestions are approved and we can alter the plan. So under the hearing aid benefit, you're entitled to a hearing aid, either repair or purchase, for a maximum of $1,500 per ear every 2 years. So we do coordinate with other plans. So if your major medical insurance plan does include a hearing aid benefit, we would coordinate with that plan. You would submit the claim, your hearing aid expense, to your major medical carrier first, and then submit it to us with our hearing aid benefit claim form with a copy of the explanation of benefits from your primary carrier, and then we would pay the maximums according to that. So again, it's every 2 years, and it's a pretty rich benefit too. And we know the cost of hearing aids are pretty expensive. The legal service benefit, we call it the in-state legal service benefit in New York State residents. It's also a wide array of services provided by the law firm that's retained by the plan, Prior Cashman, to provide all these services at discounted rates. So there is a more detailed description in the summary plan description, but it's just as one example, or probably a more widely used one, is the real estate closing, where you purchase a home in New York, or you refinance a home in New York, or a condo, or a two-family home, and the cost from soup to nuts pretty much is $575. So that's, if you looked at what the rates are going rates on the outside for closing costs, you'll see that It's usually far greater than that. So that's a good one. You also get a 2-hour free consultation every year. So if you have an issue, no matter what it is, and you need to talk to an attorney about it, you get a 2-hour free consultation. The caveat here with the legal service benefit is that it's not, the benefit claim form is not available. You need to be pre-certified by the fund office, plan office beforehand. So quite simply, you would just email me or call me. Email these days especially is preferable. And you would, I would determine your eligibility. You're eligible if you're a New York State resident. I would email you the certification form, and it has the name of the person to contact at the law firm. Her name is Peggy Beckwith, and she would put you in touch with the attorney who will handle your particular matter. And that's pretty much the way it works. And then it's off to the races with the attorneys.
And tonight we have on the line with us, Richard Bethel, one of the partners at Prior Cashman, the firm that we use. Richard, would you like to just flush anything further out as relates to the legal services benefit?
Thank you, Kevin, and good evening, everyone. The only thing I want to emphasize is that we cover virtually any legal issue under New York law. We have more than 150 attorneys in our Manhattan office. Although most of us are working remotely at this point, but we address pretty much everything. The one exception, and I do want to mention it, is any issue that arises out of your employment under a doctor's council contract, we would not handle under the legal services plan. That would be handled through the union, and we also represent the union, so we'll work with you there in the context of whatever legal issues there are, but that would not be through the legal services plan. There'd be no charge to you for anything we do related to your employment.
Thank you, Richard. And just two other aspects. Number one, we plan on having a presentation similar to this to drill down on the legal services benefit and legal topics as well on March 30th. So look for that coming out in terms of information. And then second, in terms of the legal benefit, as Dan and Richard spoke about, it's a very good benefit. 2 hours free each year, 50 hours at the reduced rate, and then covering everything from real estate issues to family and matrimonial to general representation, some licensing aspects of it. Then, of course, estate planning and estate administration. So it's a very good benefit. So thanks, Rich and Dan. Going back into the next document here.
All right, thanks, Kevin and Rich. The next benefit is a maternity adoption benefit, and this is probably the most simplistic benefit you can apply for. The maternity adoption benefit allows you to basically get a check for $2,000 if you give birth to a child or you adopt a child once per calendar year and per event. So the way you would file a claim is you would get a copy of the either the birth certificate or the adoption certificate, attach it to a maternity adoption claim form, submit it to the plan office, and then we mail you a check for $2,000. Just to be sure, there are timelines for this benefit as all the other benefits. It's a year from the date of service or in the case of date of birth or adoption. But it's pretty simple. And you could do it online, as we're encouraging most members to submit their claims through emails, which are more efficient and seem to be working pretty well. And we appreciate the cooperation by our members with that. The optical benefit, there again, you have an option, as you do with dental, to go either in or out of network. So with the optical benefit, we have a vendor or a related organization called CPS Optical. And CPS Optical has also a network of participating providers throughout the tri-state area and also some in the country, in Florida, I know they do, where you would present them with a voucher that you would need from the plan office first. And you would present it to a participating provider of your choosing. And the provider would show you, one, you get a free eye exam. And then two, they would show you what glasses, frames are covered under our plan and that you can select at no cost. So ostensibly, you can go in, get your eye exam, get a pair of glasses or a year's worth of contact lenses and walk out not paying a dime. If you decide that there's some frame that's not covered under the plan or some type of lens that isn't covered under the plan, then you would make that selection and the provider would tell you, okay, that it will cost you X number of dollars. So that would be like a co-payment, if you will. But in most cases, if you choose, you can just go in and get your exam, get a pair of glasses or contact lenses for the year, and you don't have to pay anything. So that's a pretty valuable benefit. The caveat there is you would need a voucher. You'd have to request it from the plan office first. We would email it to you. You can search for a participating provider through their network, their website, which is cpsoptical.com. You would select your plan, and then you would look for a provider in your area. And you would make sure you bring that voucher with you. Each one of your family members are also entitled to the same benefit. So, but each one would need a separate voucher. The other option is you go, say, to a LensCrafters, a Costco, Sam's, whatever, and get your eye exam, buy glasses, get 6 pairs of glasses if you want. And then you would submit a claim form, an optical claim form, where you would get reimbursed for a maximum of $300 per member per year. So suppose you go in and you buy glasses at LensCrafters and you spend $500, you would submit the claim with the receipt, and we would send you a check for the maximum of $300 for the year. The calendar year is January to December, so you're entitled to that each year. The option to go either with a CPS optical provider or go on your own is one choice. You cannot do both in the same plan year. So if you opt to go to an outside network, that's your choice for the year. If you go to CPS Optical, then that's your choice for the year. But each member of your family can decide to do something different, and that's also fine. The next benefit is physical exam. That's provided through our executive medical, which was known as affiliated physicians. They actually still use affiliated physicians as a name. And you're entitled to a comprehensive exam, yourself and your spouse or domestic partner, each year. And it's based on your anniversary of your last exam. So that's a little bit different than a year from the date you have one in a plan year. It's a year from your last anniversary of your last exam. And it's a comprehensive exam. They're located, I think, at 225 Greenwich Street in Lower Manhattan. And you, again, here, you would need a certification form. So you'd request that from the plan office. I would email it to you, and I also email executive medical at the same time, so they know to expect to hear from you. But I would be sure to bring that certification form with you the day of your appointment, which you make directly with executive medical. You don't contact the office. We don't make the scheduling. The podiatry benefit, there again is, we coordinate with primary insurance carriers who may have a podiatry benefit. A lot of them do. And yourself, spouse, or domestic partner are entitled to this benefit. There is a wide array of different services that are covered under the podiatry benefit. Probably the most popular one benefit would be for the orthotics, and there we pay or reimburse for a maximum of $450 per year for the purchase of those orthotics. The again, caveat here is if you're covered also from your primary plan, we would need you to submit it to your primary carrier first, then submit a claim form, a podiatry claim form with a copy of that explanation of benefits from your primary carrier. And then we go from there and see what they paid and what was billed, what they paid, and then the maximum that we allow. The next benefit would be, well, that's actually it. Other than the whole list of benefits that we have really add up. Because if you just took the dental alone and the healthcare cost reimbursement alone, the savings of that and the optical, the savings of that, there was a study done, and it was determined that it was at least $2,600 and change savings for a family. So if you look at some dental costs by itself, as opposed to paying out of pocket, it's a pretty big number. So nothing to be taken lightly, and we encourage you to use those benefits.
Yeah, and Dan's exactly right. If you think about it, the healthcare cost reimbursement alone is $1,000 back tax-free, and having the free dental, if you stay in network, all adds up, and then the different various benefits, a couple $100 here and there. So we encourage you to use these benefits for you and your family.
So in addition to the benefits that are highlighted in the booklet, probably the popular ones that we said, there are other ones. There's a blood benefit where you're entitled to 10 units of blood if you're confined to an institution, acute institution or hospital. There's a disability benefit if you're totally unable to perform the duties of a profession. There's a private duty nursing benefit if you're confined to a hospital, acute care facility. You have, if a doctor recommends that you have a private duty nurse, it must be an RN or an LPN. But you pay we reimburse up to $900 per 24-hour period. I think the maximum is $5,400 for the year. But if you should need that, there's a nice cushion there if you need it. There's also the psychiatric benefit that's available to spouse, member spouse, domestic partner, and it's also extended to eligible dependent children for out-of-hospital services from a licensed practitioner. So, and this is just a highlight of the benefits that are offered. Again, it's pretty wide. You have a dozen or so benefits, not costing you anything. And we, again, encourage everyone to use them. If you do have questions about it, certainly contact the plan office or the union, and we'll be happy to answer your questions.
There's also additional benefits through SEIU. You can see here on the screen where it makes reference to that. You can visit the website, unionplus.org, or call the 1-800 number. We encourage you to do that because from time to time they do change, but there's also additional benefits through there. So before we get to the SPD document, we want to take the time and answer some of the questions which were emailed in advance, and thank you to the members who did send those emails in. So Dan, let me ask you some questions, and if you could please let the members know what the answers are. And if people have further questions, please submit them in chat, and time permitting, we will get to them. Put your name and question in there. Dan, what is the plan year for the benefit plan?
So the plan year for the benefit plan is January 1 to December 31.
Okay. And if people want to submit emails or questions or email forms, they can submit it to which email address?
You can either do info@doctorscouncil.org or benefits@doctorscouncil.org. Either one will work. So you can take advantage of that.
And if people have phone numbers, they want to reach and talk to somebody?
The general office numbers is 212-532-7690, but I'm also accessible by calling or texting my cell phone 347-468-2314 or 201-681-7056.
All right. And if people want to go to our website and learn more about the benefits or get some of the forms that they need particular to the benefit, how can they do that?
So the website or doctorscouncil.org, and off to the side, there's a tab, Member Services. Click on that and bring you to Benefit Welfare Funds. And that'll bring you to the page where you can see your different plan, your plan. which is number 4.
Okay, and then the SPD, the summary plan description, and the highlight booklet, which we also emailed out to everybody a couple of times, is also on the website as well. Then there's a question regarding supplemental coverage through Doctors Council. They also have coverage through their employer-provided insurance, specifically about eye coverage. Who pays for what?
Okay, so there's an example where we coordinate with a primary carrier. Not all insurance has an optical benefit, but for those that do, you would submit your claim first to your primary insurance carrier. They are the first plan, the primary plan. And then you would submit a copy of that explanation of benefits that shows what you was submitted, what your plan paid, your primary insurance paid. And that's the explanation of benefits. And you attach that with the receipt for the services to an optical claim form. And then we coordinate between the two, find out how much was paid, and then we pay you the maximum allowable for that particular service.
So if someone doesn't have it covered under their employer insurance, then they can just go directly to here. If they do, we do coordination of benefits and look what gets paid first through the primary, and then it goes to here then. Is that
Correct, right.
This year I used my employer's health insurance for optical care. The question asks, I still have out-of-pocket expenses. Can that be submitted to Doctors Council for reimbursement?
Yes, so what you would do is you would submit the explanation of benefits from either a primary carrier or Doctors Council if we paid. So for instance, if your expense for optical was $600, your primary plan paid $100, our plan paid $3, the difference you can submit under the healthcare cost reimbursement benefit. And you would just need to attach a copy of the explanation of benefits, both from your primary, if that's the case, and from the Doctors Council. And we would pay you the maximum of $1,000.
So how can I submit my glasses bill for reimbursement? How do I do that?
Okay, so we're encouraging everyone to use the email as much as possible by either scanning or the documents and submitting it to the Doctors Council .org. And then I would, with the claims are then sent, processed, and if there's any question about it, we would let you know. I would just encourage, and this has happened a few times, make sure you're using the correct claim form. So your Doctors Council benefit plan, claim forms that come through for different, so we administer obviously different plans, one of them being, say, the welfare fund. What will happen is those claims are scanned into a folder based on that when that claim comes in. So if it says welfare fund and you're actually benefit plan, it's going to go to a different plan, and that delays the process. So if you're not sure which plan you're under, there's a question about it, please let me know and I'll be happy to explain it.
Is the optical benefit plan year January to December or July to June?
January to December, the benefits for benefit plan are on plan years January to December.
Okay. In terms of mental health coverage, my daughter started developing separation anxiety from me with COVID, and we have been doing child psychology telehealth. The insurance only pays a portion of it. Are there other benefits under Doctors Council that deals with this?
Yes, that is one of the benefits called the psychiatric benefit. And here again, as this example, United Healthcare pays a portion, and then your out-of-pocket piece is what you would submit under the Doctors Council benefit plan psychiatric benefit. So there's a claim form for that. The claim form needs to be completed. There's a section on it that needs to be completed by the provider. You would attach the explanation of benefits from United Health or whatever your plan is, along with the statement of services from your provider. And then we would coordinate the benefit. The maximum allowed amount is 50% of the reasonable cost, up to $56 per visit. So that is the psychiatric benefit. And
Gotcha. Is there a preference when you want the coalition of bills, such as medical therapy a couple of times a year? Do you want them all at one time? You want them during the yearly cycle? When should we send in the bills?
There's no real time frame or specific recommendation, but keeping in mind the time limits of when the claims are due. So the claims are due a year from the date of service, unless otherwise specified. Healthcare cost reimbursement is a little different. But in general, it's a year from the date of service. So especially if there's an ongoing treatments such as psychiatric or dental, you have to make sure that those claims are submitted timely. Otherwise, they're going to be denied because they're submitted late.
All right. We already covered the legal service benefit, and there's also going to be another presentation on it next month. Orthotics, how can I request this and how do I submit it?
So the orthotics under the podiatry benefit, you're entitled to eligible for a maximum of $450 for orthotics. It's a claim form you can get from our website, or I can email it to you. And there we coordinate with your primary carrier if that carrier provides a podiatry benefit. So you would need to submit an explanation of benefits, and if in fact they do provide that benefit, even if they paid nothing, but you submitted it and they didn't pay, we would need to see that, and then you would submit that along with the statement from the provider and the podiatry claim form to the plan office.
What type of leave exists? Disability benefit, family, etc.?
We have a disability benefit. We don't have a family leave benefit per se. The family leave should be discussed with your human resources administrator at your employer, because there's different criteria for that. But we do have a disability benefit. You must be out 10 weeks before you're eligible for disability, and you're not paid for those 10 weeks while you're out, but you must be unable to perform the duties of your profession during the time that you're out. There are claim forms that must be submitted, one from yourself, one from your attending physician, and it's important to get those in within 3 weeks of the onset of disability. If you are unable to do it, have a family member or a friend do it, because each day that it's late is added on to that 10-week waiting period.
Okay.
I'm sorry, and the maximum is $1,500 per month.
Do we need an actual card to show providers such as dentists or not?
You don't. We don't issue cards for any of our benefits. What we do recommend, especially for dental, because that seems to be where there's a lot of questions, is bring one of our claim forms with you, because it has the name of the Doctors Council benefit plan on it, and also the name of our third-party administrator, a self-insured dental service. So if a lot of members, when they speak to the dentist's office, say, oh, my benefits are Doctors Council benefit plan, and they look at you like you have 6 heads because they don't recognize that. So I've encouraged members to say, yes, we are covered through the Doctors Council benefit plan, but it's administered through self-insured dental service. And most providers recognize self-insured dental or SIDS as providers because they administer benefits for tons of other plans.
Gotcha. What is the relation of Doctors Council benefits to FSAs, flexible spending accounts? And is there coordination with the FSA?
We don't coordinate with a flexible spending account. It's different. There's no coordination. So what you would do, I mean, if you pay something from your FSA account, whatever expense you pay, then you're just submitting it as an expense, an out-of-pocket expense, and you would under the healthcare cost reimbursement. We don't coordinate with it, but any expenses that you pay out of that, of course, would be eligible for reimbursement under the healthcare cost reimbursement benefit.
All right, and then I know you touched upon it, but could you just briefly go over again, what is coordination with other benefits and how does that work?
Okay, so if you have a major, if you do have a major medical carrier, and say that for an argument, say that's United Healthcare. United Healthcare provides benefits that sometimes overlap the benefits under the Doctors Council benefit plan, such as psychiatric. So you would need to submit your claims first to your primary, in those cases, to your primary insurance carrier, and then submit the explanation of benefits, or EOBs, to the Doctors Council benefit plan with whatever service, say psychiatric, claim form, and then we coordinate between the two. And here is an example of when it's a year from the date of service, but if you submit a claim to your primary insurance carrier within a year from the date of service, we recognize that. So you're not getting penalized as long as you submit it to your primary carrier within a year from the date of service. So we look at that as well.
The next question asks, for expenses incurred for health services, the member's existing coverages that exceed the reimbursements received, including services covered under Doctors Council benefits. Would this include dental expenses above what Doctors Council covers?
Absolutely, yes. So if you went to an out-of-network dental provider and you paid $800 for a crown, say, and you were only reimbursed for $500 under the plan or whatever it was, say the difference of the $300 is eligible for reimbursement under the healthcare cost reimbursement benefit. So you would just take that explanation of benefits that you get from the Doctors Council benefit, in this case, self-insured dental, they'll send you a check. A check goes out and they have an explanation of benefits with that. You just take a copy of that and submit that under the healthcare cost reimbursement benefit. And I believe you can actually upload these on the website rather than mail them in once you create an account with self-insured dental administrators services.
Can there be consideration of a new benefit? If a member dies, can these benefits be expanded to covering surviving spouse domestic partners?
Well, currently, that's being covered through COBRA, self-pay COBRA. But this question seems to be leading to if there is an actual benefit to extend the benefit without cost to the member. We can take that under advisement.
Okay, Dan, there's a couple of questions in the chat room. We can see if we can get through them and go through them one by one. All righty, so let's see. If I use an out-of-network dentist, are the non-covered expenses, if I use an out-of-network dentist, can I use the non-covered expenses as a yearly deduction?
Yes, under the healthcare cost reimbursement benefit, you can do that.
The next question is, are my spouse's medical insurance premiums covered under the healthcare cost reimbursement benefit?
Yes, so you would just need a statement from your spouse's primary carrier that shows that, and a separate claim form for your spouse under the healthcare cost reimbursement would be eligible for that.
The next question asks about the email address to request pre-certification request for legal benefit. You can either email info@doctorscouncil.org or benefits@doctorscouncil.org. Participating providers charge contacts lens fitting fee, which is around 100 to 150. Okay, there's a question about, will this be recorded? Yes, we were endeavoring to record it and send it out after this presentation. Are contact lens purchases from online websites, e.g. 1800 contacts, eligible for reimbursement?
Yes,
Is couples marriage counseling reimbursed?
if it's for a licensed practitioner, yes, under the psychiatric benefit.
Okay. When is the deadline for applying for the $1,000 uncovered medical expenses? It must be the healthcare cost reimbursement.
So that's where the healthcare cost reimbursement is a little slightly different from the other benefits in that your plan year is January to December. So we are in January of 21 right now, and it ends December 31, 21. So expenses that you've incurred or will incur during 2021, January to December, you have until December 31 of 2022 to get them submitted to administrative services where those claims are processed, and make sure it is received by them by December 22. So it's a year from the last fiscal year ending, plan year ending.
Does a psychiatric benefit include therapists such as psychotherapists?
Yes,
So can we get reimbursement for out-of-pocket psychiatric care?
yes, licensed practitioners.
When I visit the website unionplus.org, which union do we need to select? The Service Employees International Union, SEIU, perhaps we're also under SEIU Local 10MD. Do we get reimbursement for out-of-pocket psychiatric care?
Yes, that's again from licensed practitioners.
Can we retroactively submit for the 2020 year for the $1,000 healthcare cost reimbursement?
Currently, yes, you have until December 31 of this year to get those submitted.
December 31 of
Of
2021 for anything occurred from January 1 to December 31 of 2020?
Correct.
If one missed, for example, the I benefit in 2020 because of the pandemic, are there any allowances that would allow members to get eyeglasses now in 2021?
The benefit is not extended. In other words, it's kind of like a use it or lose it. So if you didn't get glasses in 2020, it renews every year. So the answer would be no.
They can use the annual benefit.
You can use that for this year. Yeah.
Does all reimbursement come as a check in the mail? What is lead time on claims? How does that work?
Okay, so it's generally, yes, all the checks come in the mail. It's important to keep your addresses updated. And it's usually 45 days from the date that we received the claim. I try to keep on that. So
Are aged parents considered to be dependents or only spouse and children?
it's spouses and children, but I have to look closer at the SPD and see if there's, I think for grandparents, it may be. I'm not quite sure. I'll have to double check that.
Okay, so the doctor who asked that question, if you please contact Dan tomorrow, glad to drill down on that particular question for you. Is ABA covered under mental health?
Tell me what ABA stands for, so maybe I'm not.
That doctor, if you could, or perhaps Dr. Prosher could let us know ABA, but we'll come back to that if time permits. Otherwise, please call us tomorrow. What about prescription reimbursement? What is the process?
So prescription drugs are reimbursable under the healthcare cost reimbursement benefit. You can get either a statement from your pharmacist. They can give you a statement of what the expenditures were during the course of the year, or you just simply make copies of your prescription drug co-pays or payments and submit that under the healthcare cost reimbursement.
There's a question asking Dan Donlan's cell phone number. You can either call or text 347-468-2314. Again, 347-468-2314 or 201-681-7056, 201-681-7056. How is bariatric surgery reimbursed if primary insurance does not cover it?
The only way you can get a partial recovery of those expenses is through the healthcare cost reimbursement. You'd have to submit an explanation of benefits from your insurance carrier showing that it was not paid, and a maximum payment would be $1,000.
Are non-prescription sunglasses from a store like Nordstrom reimbursable?
No.
With regard to mental health benefit, if your insurance paid 80% to a provider and you paid the 20% and your part was $50 and the insurance paid $200, as I understand it, $500 is covered by Doctors Council up to $56. Do I understand that correctly?
So
This must be per visit, perhaps.
yeah, it's per visit. So it's up to $56. So if that your piece was ending up being just the 50, then you would get 50.
Okay. Is gym membership covered in the benefits?
No. Look to your primary health insurance carrier for that.
Applied behavior analysis for autism. That goes back to the previous question.
Yeah, that's what that I was going to say. Yes,
Is
that's
ABA
the
covered
question.
under the mental health?
Right now, it is not.
All right, let's see here. Kindly type the phone numbers just mentioned. They were on the screen, and if time permits, we'll type them. Otherwise, if someone needs the phone numbers, please email us tomorrow. Okay, those are the list of questions. We're going to stop sharing the screen for the time, or I can go to the next document. Actually, doctors, now what we're going to do is go to the summary plan description document and cover any benefit that has not already been touched upon. So I think the first benefit, well, let me go back here. Let's try this way. Family medical and military leave. Dan, can you touch upon that, please?
So there is, again, there's no family medical leave that would be offered through the plan. That would be through your employer. And so we encourage you to discuss that. Same thing with military leave. That's through your employer. HR, you are entitled to COBRA should you be out, you can extend your benefits, supplemental benefits under the plan through self-pay COBRA, notified our office, and we would send you a COBRA application based on your qualifying event date, the date that you lose coverage.
Can you talk a little bit about dependent coverage?
So dependent eligibility is general to age 19, including your legal spouse, domestic partner, unmarried children or grandchildren. And it's anyone under the age or up to the age 19. Once the child reaches the age 19, there's an extension under the Affordable Care Act, which allows you to have the child covered to age 26. You would need to complete a special enrollment form, which I believe is available on the website, and submit that. And then we would extend the eligibility for the child until the child reaches the age of 26.
Okay. Coordination of benefits, I believe you already covered. Claim filing procedures. Is there anything you want to point out about filing claims or time to file the claim?
Just be mindful of the deadlines, which again, in general, is a year from the date of service. And this is important to keep in mind for dental, because if you, especially with orthodontics, because that's an ongoing process that lasts, a couple of years. Don't wait until the end of the service because of the treatment, because then that has happened and those claims will be denied. So if you're filing, if your provider is not a PPO or participating provider, where they would be responsible for filing the claims, and if you are paying, make sure that those claims are filed, and I would encourage you to do it at least every 3 months.
Okay. The blood benefit.
It's basically if you're confined to a hospital and you need blood, you're entitled to up to 10 units in one period of confinement in the hospital. It is coordinated with your primary insurance, and you would need to submit a claim form for that, which is available on the website.
Okay. Dental you covered. That brings us to,
Implants. in general.
sure, if you want to talk about implants, please.
Yeah, so let's go back to the dental. There is a coverage for implants, and I understand that it's not as high as many would like, of course, but it is a $5,000 maximum, lifetime maximum for implants. So again, it is a welcome additional benefit, as many plans do not even offer it.
Gotcha.
But okay.
And the disability benefit?
A disability is, like I explained before, there's a 10-week waiting period, but be sure to file those claims. Then they're not available on the website, so contact the plan office, preferably by email, so we can email you those forms within 3 weeks of the onset of the disability. And you're eligible, if approved, for $1,500 a month. Monthly follow-up forms will be required to continue the benefit.
Okay. And then the healthcare cost reimbursement, you cover that benefit. Let's see, now going to the next benefit, the hearing aid. Anything you want to point out about the hearing aid?
I think we went over that before. It's a $1,500 per year, every 2 year maximum of $3,000 for both years, every 2 years for
Okay.
member, spouse, and dependent.
And the legal service benefit we covered as well. I'm scrolling through that.
Yeah, the state.
Okay. Then the next benefit is out-of-state Did you cover that?
No, we didn't actually. The out-of-state is for those members who live outside of New York State, and there's a legal service benefit which allows you to choose your own attorney, and for two particular services that are covered under the plan. One is for a real estate transaction, as mentioned earlier, closing of a home, purchase of a home, refinance, or preparation of a trust, will, codicil, estate planning. So those two benefits are available to get reimbursed for a maximum of $600 per year from the plan. When you choose your own attorney, you would need to submit a legal out-of-state, legal service benefit out-of-state form, which is available on the website, and a copy of the statement from your attorney, which shows what services were performed, dates of those services, and the payment.
Okay, here's a benefit I don't think you touched upon, the mammography benefit.
The mammography benefit is, again, here's where we coordinate with your primary carrier. So most insurance companies cover that, or at least a portion of it. And we reimburse for a maximum of $200 per year. You would then submit a copy of the explanation of benefits from your primary insurance carrier, showing what was submitted, what the plan paid, your carrier paid, and then we coordinate between the two and pay you a maximum of $200.
Okay, and the maternity adoption benefit?
That is where you just submit a copy of either your birth certificate of the child or an adoption certificate showing the date of the adoption, name of child, birth date, and attach it to a maternity adoption claim form, submit it to the plan office, and you get a check for $2,000.
That's a $2,000 benefit.
$2,000.
Okay. Now, optical, you covered. Anything further you want to say about optical?
I think that was it. You had a choice of going in and out of network. You need a voucher if you're going in network.
Physical exams.
Physical exams are comprehensive physical exams conducted by executive medical, and also known as affiliated physicians. The address is changed. It was changed from, it used to be on 48th Street. Now it's at 225 Greenwich Street in New York, in Lower Manhattan. You would need a voucher or a certification form from the plan office before you go. So don't contact them until you get the certification form from the plan office first.
And this is what, one exam per year? Or?
It's one per year, and it's based on the anniversary of your last exam. So it's a little bit different. So if you have an exam today, you're entitled to another exam a year from now.
Podiatry benefit, you touched upon there?
Yes.
Okay. Private duty nursing benefit.
That's where you're eligible for reimbursement for a private duty nurse or registered nurse or licensed practical nurse if you're hospitalized in a hospital or acute care facility. The maximum is $900 per event, per 24-hour period, and I believe it's $5,400 maximum for the year. Yeah, $5,400. There you go.
Okay. The psychiatric benefit.
So the psychiatric benefit is available to members, spouse, and dependents. The maximum allowable amount from a licensed practitioner is 50% of the reasonable customary cost of each visit, up to $56 per visit. It is, as I mentioned, coordinated with your primary insurance carrier. So we require explanation of benefits. In some cases, which we have, there is no, if you go out of network, there's no reimbursement from your carrier, and we would just need a statement from your insurance company that says that. And if you're paying totally out of pocket, then there is no coordination, but we just need to confirm that there is no psychiatric benefit for your plan.
Okay, that's the psychiatric benefit. Dan, can you touch a little bit and explain COBRA and how it works with respect to the benefit plan?
So COBRA is self-pay when you lose coverage either by excuse me, by termination, resignation, or any change in event. Excuse me. And you would, or you retire, you're leaving service. And we would send, you would notify the office of your event, and we would send you a COBRA application, which you're allowed to continue for a maximum of 18 months. The coverage is paid through checks to the plan office on a monthly basis. You can stop at any time if you wish to discontinue. It's from the first of the month to the last day of the month. So if you wish to discontinue, you just stop paying. But it's a maximum of 18 months. Should you pass away, surviving spouses and dependent children are eligible to continue that coverage for a maximum of 36 months. But just here, if you anticipate leaving the job and you want to continue the benefits under the plan, notify the office and we'll send you an application.
Great, thank you. And that brings us through the summary plan description, SPD document. I'm going to stop sharing screen, and Dan, that brings us back to some of the questions we had, and let's see if I can pick back up where we left off. So folks, just give me a second. If Gold is over the age of 26 but full-time student, are they covered?
Godchild, right.
It's Godchild, yes. Right.
No, major medical plans treat it differently. For a major medical plan, the child will be covered to the end of the year where they turn 26. So our plan, you would continue COBRA, you would continue coverage of the child through self-pay COBRA, and that would be for a maximum of 36 months. So you can't continue the coverage, but it would be a self-pay COBRA. Just again, notify our office and we'll send you an application.
Is there a maximum reimbursement for orthotics?
Yeah.
Orthodontics, I'm sorry.
Oh, what is it?
Orthodontics.
Orthodontics, yes. It's $4,940 for all the components of the orthodontics. And that includes initial appliance, the exam, there's a maximum per 24 month, the follow-up visits for 24 months. And then there's the quarterly visits for a maximum of 9 months. So altogether, it's $4,940.
The implant benefit is for employee and spouse. So is that $5,000 max each?
Yes.
Next question, do I need to submit the special enrollment form every year for my 21-year-old college student?
No. You would just need to submit the special enrollment form once and they're covered to age 26.
Implant benefit up to $5,000 is not
No.
clear in the dental section. Where is that published? My dentist would probably like to see it.
There is a fee schedule it should be in the SPD.
And so for the doctor who has that question, if it's not
Yeah.
clear, then please contact us tomorrow. We'll gladly point that out to you. Does the $600 real estate closing cost fees cover private New York attorneys, or does it have to be out of state?
It has to be, if the transaction is taking place in New York, if you're not a New York resident, then it only applies to those residents who are out of New York. That's the benefit. So that's the whole point of out-of-state legal services. It's $600 for a transaction by an attorney outside of New York State.
Other than that, if someone's in New York State, then it would go into the in-state benefit, which for real estate is spelled out in the SPD. And I referred people to page 34 of the SPD, where it lays out the cost for that. I thought COBRA coverage is up to 36 months in New York.
That's New York State plan is different from the plan, the benefit plan. We don't follow the same exact rules. And it is 36 months only if you're a surviving spouse or child.
Okay. Doctor, is there any other questions? We've gone through all the questions that were emailed to us and all the questions that were on the chat. Any other questions? Okay, so we hope that you have found this to be informative. We encourage you to please use your benefits. Those of your colleagues who couldn't join us tonight, please let them know about this. We've emailed it out and mailed it out to folks a couple of times. Before I close, Dr. Proscia, our president, would you like to say any closing comments or statements?
No, I think I'm trying to make this as concise as possible. Thank you very much, Dan and Kevin. An excellent presentation tonight. And, to the members who participated, please, if there's any other questions, please call the union offices tomorrow. Dan will be available to answer any questions for you going forward. Thank you.
Thanks, Dr. Proscia. And to everybody, to each of you and your families, please keep safe and keep well. And until we see you next time, and enjoy your evening. Take care, everybody.
Thank you. Good night.
Thank you.
Thank you, Kevin.
Yep, thanks.
Thanks.